Hi, this is Dr. Erin Stubblefield with the KMC University Help Desk. I recently returned from a little trip out of state, and I am one of the 82% of American adults who have or will travel in the month of August. I have to admit, I was a little sore from the travel, sleeping on an unfamiliar bed, and all of the walking and swimming. And just like many other Americans, I called my chiropractor when I got home. With increased travel comes that increased likelihood of injuries. It's a prime time for patients to overdo it, twist something, or experience new aches. This increased patient volume, particularly with activity related injuries, brings a critical focus to chiropractic compliance, especially surrounding the correct use of S coding for injuries. The S codes come from the S chapter within the ICD-10-CM manual dedicated to injuries, poisoning, and certain other consequences of external causes. For chiropractors, these codes are super important because they cover acute injuries like strains, sprains, fractures, all of which can happen with increased summer travel and associated activities. S codes require a high level of detail. You'll need to hone in on the body region, the type of injury, and often the side of the body. In addition, you may need to include severity and specific tendons, ligaments, or muscles. But let's break down the anatomy of the S code to better understand how precise these codes are. The S codes consist of 7 characters. Each code begins and ends with a letter, while the 5 characters in between are usually numerical. But from time to time, you may see 2 X's used as a placeholder when certain information related to the code just isn't relevant. The first character is always the letter S, indicating it belongs to the S chapter of codes. The second and third characters are numbers that identify the major body region where the injury has occurred. Then there's a period after the third character. The fourth character, which is also numerical, specifies the type of injury within the body region, specified by the second and third characters. The fifth and sixth characters provide additional information about the injury, such as a more specific location, like the vertebra, ligament, or muscle involved, the laterality, right side or left side, or the severity or type of injury, like a partial versus a complete tear. If these details don't apply, that's when you may see that XX that appear in those positions. And finally, we get to the 7th character. That 7th character is for the encounter extension, which is needed to communicate the current phase of patient treatment related to that injury. There are 3 options for this final character. The letter A, which stands for an initial encounter. This is the patient in the acute phase and receiving active treatment. Then we have the letter D, which is for a subsequent encounter. The patient is in the healing or recovery phase or receiving routine follow-up care. And then we have the S, which stands for sequela, indicating a late effect or a complication of an initial injury after that acute phase has passed. The last character is probably the trickiest because many chiropractors will only use that letter A for that E&M visit of the new injury. But the truth is we should be using the A for the duration of the active phase treatment plan, not just that initial encounter visit. And there's many situations where the chiropractors will only be using the letter A and they will never use the letter D or the letter S. So please make sure that you understand your payer policies related to this 7th character. Lastly, the complete S code is like a beautiful summer peach pie, and the components of the code are like the ingredients of the pie. So if you're missing any one ingredient, that pie is just not going to be as good as it could be. So your documentation, which is the ingredients, needs to be complete for the best possible outcome. If you enjoy this content, then follow KMC University on all of our social media platforms for more compliance tips from the chiropractic, reimbursement, and compliance experts.